Hello, I'm Dr. Pizzadili. This video is part of my series, Happy Outcomes for Cancer Patients, number 20, Lung Cancer. These case reports are from the book, One Man Alone, an investigation of nutrition, cancer, and Dr. William Donald Kelley. The book was written by Dr. Nicholas J. Gonzalez, completed in 1987 and published in 2010 by New Spring Press. This research was supervised and the cases verified by Dr. Robert A. Good, who was director of Memorial Sloan-Kettering Cancer Center in New York City, one of the oldest and largest cancer research centers and hospitals in the world. Our patient number 20, it's on page 236 to 246 in the book, was a 59-year-old female. She had metastatic recurrent lung carcinoma. And she survived this cancer 12 years after the initial diagnosis, which is amazing. At the end, she died from medical malpractice when a doctor punctured her lung doing a bronchoscopy. Now, patient 20 smoked 2 packs of cigarettes a day for 25 years. That's 365,000 cigarettes. So when you wonder, are you going to get lung cancer from that? For many years, she had a dry, hacking smoker's cough, and she was prone to get recurring illness. At one point, she had pneumonia and got radiation treatment for the pneumonia that destroyed her thyroid. So she now had a permanent thyroid condition. The patient reported that she never felt well after that radiation. And she reported chronic fatigue, mood swings, and a constant worn out feeling. Okay, this could be cancer, could be the thyroid, or usually, in this case, both. In 1971, her husband got colon cancer, which was then supposedly cured by surgery. And the patient was in a lot of anxiety and worry and depression about her husband's health. 1974, the husband's colon cancer recurred, and patient 20 investigated alternative methods to help him. She read Dr. Kelley's book, One Answer to Cancer, but her husband refused to pursue the program. In 74, she had frequent coughing, blood-tinged sputum, and a chronic low-grade fever. In January of 75, X-rays showed an abscess in her left lower lung field. She got a 2-week course of antibiotics for that, what they thought was an infection, but her cough worsened, and in February of 75, she was admitted to St. Joseph's Hospital in Kirkwood, Missouri. New X-rays showed that abscess actually looked like cancer. So she had exploratory surgery that found a large tumor. So they removed her lower left lung. This was diagnosed as bronchogenic carcinoma, aggressive and metastasized to lymph nodes. And folks, metastasize means that it's spreading. That's stage 4 cancer. 11 days after that tumor was removed, she had the rest of her left lung removed. And she was prescribed chemotherapy. Well, this patient returned home to find a very sick husband. Remember, he's got colon cancer. So her husband begins chemotherapy and radiation, and when that begins, he rapidly worsens. He goes steadily downhill and dies. Watching her husband deteriorate, this patient refuses all conventional treatment. She didn't want to go like he did. So she has Dr. Kelley's book, One Answer to Cancer, and she follows Dr. Kelley's program outlined in the book. And she really did it on her own without any other help. Within 1 week, she quit smoking. She quit alcohol, junk food, and tranquilizers. And she began the nutrition therapy, the supplements, the pancreatic enzymes, and the coffee enemas, and a cancer diet, anti-cancer diet. the patient notices almost daily improvement in her health. She follows the program for 2 years until she feels herself cured. And then she gradually reverts to a junk food diet. I wonder if she'd get an occasional cigarette too. But in early 1978, her symptoms return. In September of '78, she resumes the thyroid medication, still appearing cancer-free. Now, I don't know why she gave up the thyroid medication once her thyroid had been burned out. I suspect she had low confidence in any conventional medical treatment. Well, in October of '79, the x-rays showed recurring metastatic nodules now in her right lung. And in December of '79, a tomogram confirmed 2 lesions in the right lung, metastatic disease. This is very bad news. In March of 1980, the x-rays showed that the tumors increased in size. They were metastatic. So the patient resumes the Kelley program of nutrition, detoxification, and enzymes, and stays on it. And her health problems improve, her lung masses regress. And she is healthy and happy and apparently cancer-free. However, in November 1986, this is 6 years later after her second bout, she develops influenza and pneumonia. She's admitted to the hospital for a bronchoscopy. And during the procedure, the surgeon punctures a pulmonary artery. And this poor patient bleeds to death in 1 hour. We have to understand the incredible positive outcome that this patient enjoyed. Bronchogenic carcinoma has dismal odds. For those who are treated aggressively with surgery, radiation, and chemotherapy, the 5-year survival rate is only 12%. Patient number 20 lived 12 years from her original diagnosis and 6 years since the recurrence. And after the recurrence, she only used the Kelley program. So ladies and gentlemen, you must understand that relying on the conventional cancer treatment industry is risky. Their treatments are dangerous, and very often their outcomes are not good. They are focused on shrinking tumors, not on restoring health. The conventional cancer treatment, we know that chemo and radiation cause cancer. They are themselves carcinogenic. And we know that surgery and biopsies spread cancer. They release circulating tumor cells to travel throughout your body and metastasize. So consider your responsibilities to yourself and your family, to the people who love you, to the people who depend on you, to the people who want you around. Are you doing everything possible to restore your health and to live a long, healthy, and happy life? To survive cancer, you must establish these foundations of health. You must have optimal body pH. That's your acid-alkaline balance. Most people in America are very acid, and it throws off their whole biochemistry. Being acid means their body is starved for oxygen. And so your digestion, all these biochemical reactions don't work right. Your immune system does not work right. And Dr. Otto Warburg established this back in the 1930s and won a Nobel Prize. He also said that cancer cannot live in an acid environment. And most Americans, the last time we were checked, the average American was 5.5. Now the optimal score is 7.2, and each 0.1 change in pH is a 10-fold change in tissue oxygen. We must balance hormones. We're living through an epidemic of hormonal cancers: breast cancer, ovarian cancer, uterine cancer, testicular cancer. Our hormones are under attack. And I believe It's from the estrogenic chemicals that are in pesticide residues in our food. We've got to get our hormones balanced and restored. We must detoxify the body and the mind and emotions. We're exposed to thousands of chemicals that were never around 100 years ago. We're under chemical attack. Now, as far as mind and emotions, we all have mental and emotional patterns, many from our childhood or from years ago, from events or misunderstandings that can lead to self-destructive tendencies or hopelessness or depression, which can lead to cancer. We must eliminate infections. Now, infections can deplete your immune system and wear out your body's ability to kill off cancer cells. One of the leading causes of liver cancer is chronic hepatitis C, and we're in an epidemic of hepatitis C infections. We must rejuvenate depleted organs, glands, and systems. One of the top risk factors for cancer is simply aging. As we get older, our body becomes depleted of essential nutrients and compounds, and our immune system becomes weaker, our vitality becomes weaker, and we're more susceptible to coming down with infections, including cancer. And we must use the most appropriate and proven cancer-fighting nutrition that helps restore your immune system so that your body can defeat this condition. So, ladies and gentlemen, if you have cancer, get help. Call my office, 907-272-6299. I'm not going to be your medical doctor. I'm not going to be your oncologist. But I will help restore your health and restore your immune system so that you can recover from this condition, so that your body can heal itself, and so that you can live a long, healthy, and happy life. So I look forward to seeing you, and I look forward to changing your life for the better. Thank you. I'm Dr. Pizzadili.